Good morning, good afternoon, and good evening, everyone. Ladies and gentlemen, welcome to our event 5th MONEV Safari series, Monitoring and Evaluation Seminar for Intermediate and Advanced Level, Ensuring No One Left Behind Principle in Vaccination and Social Protection Policies in the New Normal Era, Innovative Policies and Role of Evaluation in Indonesia and countries in the Asia Pacific and African regions. We also want to say to thank you and a warm greeting for our fellow from Malaysia and Nigeria that have been joining to the seminar. Before we start the seminar, let me inform you about the webinar rules. Selamat siang, Bapak dan Ibu yang telah hadir. Selamat datang pada acara rangkaian MONEV Safari kelima, Monitoring and Evaluation Seminar for Intermediate and Advanced Level, Ensuring No One Left Behind Principle in Vaccination and Social Protection Policies in the New Normal Era, Innovative Policies and Role of Evaluation in Indonesia and countries in the Asia Pacific and African regions. Sebelum seminar dimulai, izinkan saya untuk membacakan peraturan webinar. Before we start the seminar, make sure you have a stable internet connection and keep your position in a quiet and comfortable room. After entering this Zoom room, please make sure you change your name into the format name and institution or organization by clicking on the rename option on your Zoom profile. Also, make sure to turn off your microphone during the speaker session for mutual comfort. If there are any questions during the session, you can type in the chat box or using the raise hand feature to be given the opportunity to speak after being appointed by the moderator. We ask the participants to fill in feedback and also a clear name for the sake of the certificate after the event. The feedback link will be given in the chat box. Seminar will be delivered in bilingual language. Translation in Bahasa will be provided in the chat box. Bapak dan Ibu, sebelum kita memulai seminar, mohon untuk memastikan bahwa koneksi internet Bapak dan Ibu telah stabil dan usahakan agar berada pada posisi di dalam ruangan yang hening dan nyaman. Setelah memasuki ruangan Zoom ini, mohon untuk mengganti nama dengan format nama dan juga institusi atau organisasi dengan cara klik opsi rename pada profil Zoom Bapak dan Ibu. Mohon untuk memastikan bahwa mikrofon dalam keadaan mati selama paparan berlangsung demi kenyamanan bersama. Apabila ada pertanyaan selama sesi berlangsung, Bapak dan Ibu dapat mengetiknya pada kolom chat di dalam Zoom ini, atau juga dengan memanfaatkan fitur raise hand yang nanti kemudian akan diberikan kesempatan berbicara setelah ditunjuk oleh moderator. Kami mohon kepada para peserta juga untuk bersedia mengisi umpan balik dan juga nama jelas dan lengkap untuk kepentingan sertifikat setelah acara. Tautan untuk mengisi umpan balik tersebut juga akan diberikan pada kolom chat. The seminar will be hosted by Iwan Febrianto as our Head of Social Outreach and Capacity Building in MONEV Studio. Please welcome Mr. Iwan Febrianto. The floor is yours. Acara seminar ini akan dibawakan oleh Bapak Iwan Febrianto. Kepada Bapak Iwan, kami persilahkan.
Thank you, Mbak Wina. Good afternoon, good evening, ladies and gentlemen. Welcome to join the virtual seminar 5th from MONEV Studio with the theme Ensuring No One Left Behind Principle in Vaccination and Social Protection Policies in the New Normal Era. Policy innovation and the role of evaluation in Indonesia and countries in the Asia Pacific and African region. Friday, February 26, 2021. Thanks God Almighty for all His gift and mercy. In the condition of the COVID-19 pandemic, we are all always in good health and adhere to health protocols. Distinguished Mr. Asela Kalugampitia, from Asia Pacific Evaluation Association. Honorable mention, Mr. Eric Yan Kejiam from EVAL Indigenous. Honorable Ibu Vivi Yulaswati, Ministry National Planning Bappenas. And also honorable mention to Mr. Benny Suharsono, co-host and head of Bapeda Yogyakarta Special Region Province. Dear Ms. Umi Hani, founder of MONEV Studio and partners. Aims and objective of the seminar. MONEV Studio is a startup to promote sustainable development, evaluation literacy, and inclusiveness with an interdisciplinary platform to facilitate learning and advancement in development studies, monitoring and evaluation, and policy management. MONEV Studio aims to help the local, national, regional, and global development community to work together and deliver better services and results for more equal development in Indonesia and global. In addition to M&A professional network, MONEV Studio have mission is to broaden the network and contribute to enhancement and advancement of critical thinking, knowledge and skills of the civil society actors with good literacy about development and how to critically evaluate it. MONEV Studio work through facilitation of learning, enhancing and advancing the thought, knowledge and skills in development studies, M&A, and policy management by using various of means from online learning platform, promotion and public campaign, advocacy, seminar, workshop, training, summer course, conference, internship, sharing, co-working space, collaborative work, and doing real evaluation project. The core knowledge and skills we offer is to have critical thinking, advanced logic, and knowledge about development performance and result. Ladies and gentlemen, MONEV Studio is founded by Umi Hani, a professional in development research and evaluation, who has been working for many bilateral and multilateral organizations in Indonesia for past 18 years. Being adaptive with 4.0 Industrial Revolution call, MONEV Studio was established to make development studies and evaluation literacy become more accessible and inclusive for everyone. She engaged young and emerging evaluators to be part of her team. In line with the mission, MONEV Studio works closely with development practitioners and professional, voluntary organizations for professional evaluation members, academia, social activists, journalists, researchers, consultants, national leaders and local leaders, government officials, parliaments, community leaders, public figures, NGO, and also bilateral and multilateral donors. In addition to institutional building and product development, since September 2020, MONEV Studio is starting the social outreach mission through MONEV Safari, a monthly event to promote and advocate the greater use of evaluation across the country. The Safari is co-hosted by the regional government to introduce an intermediate and advanced level of evaluation to the subnational government and GSO. The topic selection is based on relevant policy issues in Indonesia and the progress toward building better M&A practices, as well as reflection with peer countries in the region and global level. Therefore, as part of our evaluation commitment, continuous learning effort in Indonesia, and particularly looking at the current dynamic in the country, MONEV Studio intends to hold the monthly MONEV Safari event by inviting expert and highly skillful speakers in policy innovation and M&A to be part of the safari. Objective: anticipating the impact of the pandemic that has not ended. The government of Indonesia has exercised with some policy innovation and decided to extend the social safety net or social protection for the lower middle class society until 2022. The decision is in line with the implementation of vaccination policy, which will also last until 2022. In addition, social assistance is also to support economic stimulus policy for micro, small, medium enterprise. Social assistance program implemented by the government ranging from basic necessities to direct cash assistance, including vaccination and small, medium enterprise stimulus, need to ensure their effectiveness and distribution for the lower middle class. With regard to this support, the unified database system become the reference for vaccination implementation, as well as the initial data for providing social assistance and the above stimulus policy as the key infrastructure to ensure that no one is left behind. A single data system infrastructure is used to ensure targeting accuracy and minimize the possibility of duplication. The support raised questions on how is the role of M&A to support the above policy innovation and the greater inclusion. Related to the above mentioned, MONEV Studio with Bapeda of Yogyakarta Special Region and Central Java Province will host the 5th MONEV Safari with the theme ensuring the no one left behind principle in vaccination and social protection policies in the new normal era. Policy innovation and the role of evaluation in Indonesia and countries in the Asia Pacific and African region. Ladies and gentlemen, next to opening remarks, before we start presentation and discuss, then let us listen to remarks and presentation from the head of the Yogyakarta Special Region Province Development Planning Agency, Bapak Beni Suharsono, as well as opening the Safari MONEV 5th seminar today. For Pak Beni, please invite you. Thank you.
Pak Beni, now the floor is yours, or maybe the representatives. Okay. So perhaps while waiting for Pak Beni, let me introduce all the panelist presenters for today meetings. So Bapak and Ibu, Ladies and gentlemen, thank you for attending the 5th MONEV Safari sessions. We are happy to welcome you here and also to the distinguished participant from Indonesia and Malaysia and from Nigeria. Thank you for participating in the MONEV Safari sessions. So we believe that this topic is really relevant in our countries today. Bapak and Ibu, in early 2020, the coronavirus disease or COVID-19 pandemic hit the world, including Indonesia, and also in Malaysia, Nigeria, in all regions, Asia Pacific, Africa. So this is why this topic is really relevant in our region today. So this pandemic triggered the implementation of policies to limit the operation of public facilities and large-scale social restriction in a number of regions in Indonesia and also, I believe, other countries to reduce the spread of the virus. So, Bapak and Ibu, the government of Indonesia itself has exercised with some policy innovations and decided to extend the social safety net or social protection, including the vaccination, for the lower middle class society until 2022 to address the impact of this COVID. So how evaluation can relate? We believe in the principle of no one left behind to boost inclusive policy in Indonesia and also to promote in the region and also a global level. The leaving no one behind principle is the central transformative promises of the 2030 agenda for the sustainable development and sustainable development goals. We believe that this principle represents the commitment to reduce the inequality in all countries, to eradicate poverty in all forms, and also to end discrimination and exclusions, and to reduce the inequalities and vulnerabilities that leave people behind and undermine the potential of individuals and humanity as a whole. So how this principle is embedded in the current policy, evaluation policy design in Indonesia and also in other countries in Asia Pacific and Africa. So that's why we are here to discuss these burning topics. Now let me introduce the panelists today. So we have Asela Kalugampitia. Asela, please turn on your video. I saw you here. Thank you for yes. Asela? Okay, so Asela is
yes.
Yeah.
Yes.
Okay, please say hi to the audience. Greetings to Indonesian audience and also the other regions. So Asela is the Sri Lanka lawyer. So currently he is the president of Sri Lanka Evaluation Association, SLEVA, and also the Asia Pacific Evaluation Association or APIA. He is the president now. So Asela has been working in the monitoring and evaluation field for over 2 decades, including for international organizations such as the International Organization for Cooperation in Evaluation. This is the umbrella for all evaluation association in the world. And then the International Development Law Organization, IDLO, and then UN Women, UNICEF, UNFPA, and other UN family members. He is also the alumni of IPDET. So basically, this is a very good news for IPDET reunion because myself and also Ibu Vivi is the IPDET alumni from a different generation. Okay. And then we have, thank you Asela, and then we have Serge Eric Yaku from Cameroon. Serge, could you please turn on your video? Yeah. So third is the credential evaluator. He is the chair of the EVAL Indigenous and former president of the African Evaluation Association. So he is very famous in the region and also globally among evaluation association. So he spent the 15 years of conducting research, evaluation, and lecturing in Africa, around 24 countries, which is really numerous, and then North America, Middle East, and also Asia. He works with stakeholders at multiple levels, including community-based organizations, donors, and funders, with USAID, Global Affairs Canada, European Union, GIZ, government partners, and UN agencies from the all UN family. Thank you, Serge. We are really pleased to have you here. And then we have Ibu Vivi Yulaswati. So Ibu Vivi will give an insight from Indonesia policy perspective. Ibu Vivi, could you please turn on your video? Thank you for being here. So Ibu Vivi is the senior advisor to the Minister of National Development Planning for Social Affairs and also poverty reductions. Ibu Vivi main responsibility is to do analysis and provide advices to the minister on related issues, policies, and also strategies. She is the leader of the Social Pillar Working Group on the Sustainable Development Goals. She has long experiences in developing major poverty reduction programs in Indonesia and also major reforms in social protection, from the community-driven development, conditional cash transfer, and some subsidy reforms. She has major contribution in the development of the National Social Security System, National Strategy for Finance Inclusion, and Big Data for Public Policy Research through Global Pulse Initiative. Thank you, Ibu Vivi. We are very pleased to have you here. And then before we start the panel discussion, we would like to have Bapak Benny to give some opening remarks and also to provide with some brief profile of the monitoring and evaluation for social protection in Yogyakarta. Thank you, Pak Benny. Now the floor is yours.
Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Insyaallah mudah-mudahan semua dalam lindungan Tuhan Yang Maha Kuasa. Yang kami hormati founder MONEV Studio, Ibu Umi Hani, Head of Social Contract and Capacity Building MONEV Studio, Bapak Iwan Tianto, yang kami hormati, Presiden of Asia Pacific Evaluation Association, Mr. Asela Kalum Gampitia, yang kami hormati, Ketua EVAL Indigenous, EVAL Partners Credential Evaluation, Mr. Sergei Eric Yakel Jiang, MSI, yang kami hormati. Tidak kalah pentingnya, Ibu Dr. Vivi Yulaswati, MSI, staf ahli Menteri Perencanaan Pembangunan Nasional Bidang Sosial dan Penanggulangan Kemiskinan, yang kami hormati, serta peserta seminar monitoring dan evaluasi tingkat menengah dan lanjut. Pertama-tama, marilah kita memanjatkan puji syukur kehadirat Allah Subhanahu wa Ta'ala Yang Maha Kuasa, karena berkat rahmat dan karunia-Nya kita masih diberi kesempatan, kesehatan untuk hadir bersama-sama mengikuti seminar monitoring dan evaluasi tingkat menengah lanjut yang diselenggarakan melalui forum Zoom secara daring yang diselenggarakan oleh MONEV Studio. Tidak lupa, marilah kita selalu memohon kepada Allah Subhanahu wa Ta'ala, Tuhan Yang Maha Esa, agar selalu diberikan nikmat kesehatan di tengah pandemi ini. Ibu, Bapak, Saudara hadirin yang berbahagia, kami mengapresiasi dan menyambut baik undangan seminar monitoring dan evaluasi tingkat menengah lanjut yang diselenggarakan oleh MONEV Studio yang bermaksud untuk merefleksikan dan berbagi pengetahuan serta wawasan terkait dengan evaluasi kebijakan penanganan COVID-19, termasuk halnya vaksinasi dan perlindungan sosial yang inklusif, pembangunan kerjasama kolaboratif melalui praktek MONEV yang lebih baik, serta peningkatan kapasitas pelaku MONEV melalui peer learning platform. Melalui forum ini, perkenankanlah kami merefleksikan tahun 2020 yang lalu menjadi tahun yang memiliki banyak tantangan untuk mencapai tujuan dan sasaran pembangunan di DIY berkenaan dengan dampak pandemi COVID-19 yang menyeluruh pada semua aspek kehidupan masyarakat dan memaksa kita semua merancang ulang pelaksanaan, mengefisienkan sumber daya yang ada serta beradaptasi dengan apa yang disebut dengan norma kebiasaan baru atau new normal. Seminar monitoring dan evaluasi tingkat menengah lanjut yang diselenggarakan oleh MONEV Studio ini mengambil tema memastikan prinsip no one left behind dalam kebijakan vaksinasi dan perlindungan sosial di era new normal. Inovasi kebijakan dan peran evaluasi di Indonesia serta negara-negara di kawasan Asia, Pasifik, dan Afrika. Selain mengemukakan norma kebiasaan baru dalam situasi pandemi COVID-19 dan ruang lingkup internasional, tema ini melibatkan agenda 2030, tujuan pembangunan berkelanjutan atau Sustainable Development Goals, SDGs, yang mengimplementasikan prinsip-prinsip universal, integrasi, inklusi untuk meyakinkan bahwa tidak akan ada seorang pun yang terlewatkan atau no one left behind. Daerah Istimewa Yogyakarta memiliki komitmen tinggi untuk melaksanakan tujuan pembangunan berkelanjutan sesuai dengan Peraturan Gubernur DIY Nomor 34 Tahun 2018 tentang Rencana Aksi Daerah Tujuan Pembangunan Berkelanjutan tahun 2018-2022 yang telah diubah terakhir dengan Peraturan Gubernur Daerah Istimewa Yogyakarta Nomor 86 Tahun 2019. Berdasarkan hasil evaluasi tahun 2020, dapat kami sampaikan bahwa dari 168 indikator, 91 indikator atau 54,1% dapat tercapai. 63 indikator akan tercapai, sekitar 37,5%. Dan 14 indikator atau 8,4% yang tidak tercapai. 13 indikator yang pencapaiannya belum sesuai dengan target, diantaranya terkait dengan tingkat kemiskinan daerah. Perintah saya penduduk hidup di bawah garis kemiskinan, itu di dalamnya ada 2 indikator. Kemudian koefisien Gini dan lain-lainnya. Meskipun kegiatan-kegiatan pembangunan dilaksanakan lancar sesuai dengan protokol kesehatan pandemi COVID, indikator-indikator outcome SDGs di DIY mengalami hambatan pencapaian karena situasi daerah selama pandemi mengalami kontraksi ekonomi, di mana pertumbuhan ekonomi sampai dengan triwulan keempat 2020 sebesar minus 2,69%. Ini bila dibandingkan dengan pertumbuhan year to year di tahun 2019 yang tumbuh 6,59%. Ini dapat menggambarkan lesunya sendi-sendi kehidupan sosial ekonomi di berbagai sektor. Lesunya perekonomian tersebut berdampak pada peningkatan prosentasi penduduk miskin dari 11,44% di September 2019 menjadi 12,80% di September 2020. Secara umum dapat kami sampaikan kinerja pembangunan DIY tahun 2020 sebesar 98,86 dari aspek program kegiatan perlu dievaluasi dengan cermat sebagai bahan perencanaan tahun 2022 dan refleksi untuk pelaksanaan pembangunan 2021. Kebijakan nasional dan refocusing perencanaan penganggaran dalam rangka penanganan pandemi COVID-19 tahun 2020 berdampak besar pada capaian program, kegiatan maupun sasaran Pemda DIY secara keseluruhan. Dampak tersebut tidak terbatas pada berkurangnya anggaran dan perubahan desain kegiatan secara masif pada semua OPD, tetapi juga berdampak pada struktural pada capaian outcome sasaran maupun program. Ibu Bapak, panelis serta hadirin sekalian yang kami hormati, berkenaan dengan penanganan pandemi COVID-19 di DIY, berbagai upaya telah dilakukan dalam rangka pemulihan kondisi sosial ekonomi melalui kerangka kebijakan provinsi, kabupaten, kota, bahkan sampai ke desa dan kelurahan. Belanja pemerintah melalui belanja tidak terduga, dana insentif daerah dan lain-lainnya sesuai dengan arahan Bapak Presiden yang telah dioptimalkan sejak kuartal ketiga 2020. Meskipun masih kontraksi, belanja pemerintah dan sektor-sektor usaha yang diungkit memberikan kontribusi untuk perbaikan kinerja perekonomian DIY sejak kuartal ketiga tahun 2020. Respon pemerintah daerah, dunia usaha, sivitas akademi dan unsur masyarakat beradaptasi dengan norma adaptasi kebiasaan baru atau peranatan anyar dirupakan dengan usaha-usaha kolaboratif dalam bentuk transformasi ekonomi digital, pengelolaan layanan meminimal kerumunan, sertifikasi layanan jasa wisata, adaptasi dengan pandemi, insentif jasa ongkos kirim, dan lain-lainnya inovasi yang dilakukan. Selain itu, juga telah diupayakan dukungan untuk memberikan alokasi pada sektor kesehatan dan jaring pengaman sosial, serta sektor pendidikan yang terdampak masif oleh pandemi yang dilaksanakan secara keseluruhan sebagai rencana operasi pencegahan dan penanganan COVID-19 fase 1, tahap 1, tahap 2 dalam 13 fase. Rencana operasi tersebut didukung dengan anggaran belanja tidak terduga sebesar 342,6 miliar dengan berpegang pada prinsip SDGs, no one left behind, untuk melindungi seluruh warga. Jaring pengamanan sosial yang disiapkan Pemda DIY mencapai 183 miliar atau 53,49 dari total BTT tahun 2020 berupa bantuan sosial untuk lansia terlantar yang tinggal sendiri sebanyak 750 KK, bansos difabel sebanyak 375 KK, bansos warga terdampak COVID-19 sebanyak 169.383 KK, dan bantuan sosial bagi mahasiswa luar daerah yang tidak bisa pulang sebanyak 469 orang. Pendataan penyaluran bantuan sosial tersebut didukung oleh kabupaten kota sampai ke level desa dan kelurahan maupun lembaga perbankan serta dilaksanakan dengan memperhatikan protokol kesehatan. Bergairahnya perekonomian DIY dengan menurunnya kontraksi harus terus diselaraskan dengan upaya pencegahan dan penanganan wabah COVID-19. Dalam hal penyelarasan antara pertumbuhan ekonomi dan penanganan pandemi tersebut, Pemda DIY telah melaksanakan kebijakan pemberlakuan pembatasan kegiatan masyarakat yang dikenal dengan PPKM, sesuai dengan kebijakan PPKM Jawa dan Bali. Pelaksanaan kebijakan memperlakukan pembatasan kegiatan masyarakat atau PPKM di Jawa dan Bali berhasil menekan jumlah kasus COVID-19 secara signifikan, minus 17,27% dalam waktu sepekan. PPKM tersebut telah ditindaklanjuti sampai dengan level mikro dengan periode 23 Februari 2021 hingga 8 Maret 2021 sesuai dengan instruksi Menteri Dalam Negeri nomor 3 tahun 2021 yang terakhir diperbarui dengan instruksi Menteri Dalam Negeri nomor 4 tahun 2021 serta ditindaklanjuti dengan instruksi Gubernur nomor 5 tahun 2021. Bapak Ibu panelis serta hadirin sekalian yang kami hormati, berkenaan dengan upaya pencegahan dan penanganan COVID-19, Pemda DIY maupun Pemkab, Pemkot, Desa Kalurahan telah melaksanakan upaya vaksinasi secara bertahap. Tahap pertama 14 Januari 2021 yang diwakili oleh unsur pimpinan dan tokoh masyarakat. Pada 1 Maret 2021 DIY akan melaksanakan vaksinasi massal pada kelompok sasaran 19.897 yang terdiri dari 8.144 pedagang pasar Beringharjo dan sekitarnya, 2.1 2.600 pedagang sekitar Malioboro dan alun-alun utara, serta 9.153 pegawai toko yang ada di sepanjang Malioboro. Kemudian vaksinasi tersebut akan berlanjut pada tahap dan kelompok masyarakat berdasarkan pendataan yang telah dilakukan sebelumnya, serta mempercepat terjadinya herd immunity yang dapat dirasakan manfaatnya untuk seluruh masyarakat. Pemda DIY berkomitmen melaksanakan vaksinasi sesuai dengan kebijakan pemerintah terkait dengan efikasi vaksin dalam kurun 300 hari ke depan. Mengelola, menghitung dengan cermat kebutuhan vaksin, melakukan komunikasi publik yang efektif, serta mendorong partisipasi stakeholder untuk mendukung implementasi program ini. Adapun kekurangan dan kendala penanganan COVID-19 di DIY merupakan keniscayaan karena pandemi ini merupakan sesuatu yang baru, menuntut kesikapan, adaptasi, serta kolektivitas. Bapak Ibu hadirin sekalian yang berbahagia, berkenaan dengan kegiatan seminar ini dapat kami informasikan pelaksanaan MONEV di DIY telah menggunakan basis sistem informasi sebagai pendukung dashboard perencanaan dan penganggaran dalam rangka membantu pengambilan keputusan. Selain menggunakan kerangka regulasi, pengendalian, dan evaluasi sesuai peraturan pemerintah dan peraturan menteri terkait, Pemda DIY dan kabupaten kota telah mengembangkan kerangka logis pelaksanaan monitoring dan evaluasi sesuai dengan konteks dan kebutuhan masing-masing. Misalnya dalam konteks DIY, adanya urusan atau kewenangan keistimewaan. Kemudian forum diinisiasi oleh MONEV Studio ini kami harapkan dapat memberikan pencerahan dan pembelajaran bagi kami di DIY sebagai upaya terus berkembang dan memperbaiki diri. Kami sebagai Pemda ingin terus beradaptasi dan melakukan perubahan sebagai bekal penting kita untuk tetap survive di tengah-tengah masa sulit ini. Demikian, semoga sumbang saran dan ikhtiar kita bersama mendapat ridho dari Allah Subhanahu wa Ta'ala, Tuhan Yang Maha Esa. Semoga kita semua selalu sehat, bahagia dalam masa pandemik ini. Sekian, terima kasih. Billahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh. Salam sehat. Terima kasih.
Thank you, Pak Benny, for a very informative profile on the current situation regarding the social protection and also vaccination policy in Yogyakarta. This is very an eye-opening for all of us, I think. But apologies for non-bahasa speaking participant and also to our honorable speaker here, Asela, and also Serge. The translation is more general. Yeah, but we will have a full presentation in English in a later sessions. So basically, Benny has outlined some important points because soon the vaccination will be implemented to around 19,000 people in Yogyakarta, which is require a good evaluation. So he expect that from the current discussion, he will get some insight and also reflection on evaluation based on some practices in other countries and also other regions. Thank you again, Pak Benny.
Okay,
Thank you. Yeah. So before we start with the panel discussion, just a little housekeeping before we get started. So Bapak and Ibu. So Bapak and Ibu, if you have any question during the presentation, please type them into the question box in the chat box in the control panel. We will bring them up during the question and discussions before the session is end. And also we will provide subtitle in English to all non-bahasa speakers. So we don't have to worry. And also for non-English speakers, we will provide the translation to Bahasa. Yeah. Now, without further ado, we will turn the time over the first panelist, Asela Kalugampitia, the President of Asia Pacific Evaluation Association. Asela, please, now the floor is yours for around 20 minutes. Thank you.
Thank you, Umi, and thank you, MONEV Studio, for inviting me for this presentation. I'm really happy to do it. I see our friend Sir Jerick is also there. Happy to be with all these panelists in this wonderful session, and also my congratulations to MONEV Studio for doing this monthly webinars, especially in English and local languages. That is also important in many countries. Monitoring and evaluation discussions are not available in local languages. Unfortunately, I don't speak Bahasa. I have to do my presentation in English, but at the same time, I hope participants will understand what I'm sharing. So with the time, very shortly about the region, I'm outlined policy in Indonesia with the COVID situation. Next slide. I'm not going to deep COVID-19 situation. I know that other panelists are going to talk about the global situation, the numbers and all. So I just want to mention that when COVID hit the world, and we thought that world is so sophisticated that any disaster can be managed by our countries, especially developed countries will not be affected, but mainly the developing countries will be mostly affected. But COVID proved that the other way around. No travel, no personal interactions. You are unable to like that. Even where you have power, technology, it's developed countries. Developed countries were affected. So this was, different to other pandemic and other situations. Millions of people lost their jobs, and education was not possible, especially schools, and there were many opportunities were not possible because of the COVID situation. And I must say, all the countries were affected. All the segments in the society were affected. But when we have to see that, how find out, who are mostly affected COVID-19 situation. Next. People, the marginalized populations or disadvantaged communities were mostly affected. So even the governments took some policy measures to help these, marginalized populations or mostly affected people. At the same time, governments, had, general policies as well. I have, a few examples due to the time constraint. If you take Sri Lanka, government provided, 5,000 rupees. That is actually about $25. They provided this 2 times per family during the COVID lockdown and even after that. But government provided this for millions of families. So it is not only for the mostly affected families, but of course everyone was affected. But at the same time, if you see mostly affected communities, whether mostly they are day laborers, no proper income, and they are in poverty, no health facilities. At the same time, when you get $25, 1 or 2 times grants during 9 months, 8 months. Whether it is enough is the question. And also government provided concession for loan payment, but at the same time that concession is to delay the repayment in 6 months. Again, you have to pay the interest and other definitely the installments. So people, it was not a concession at all. And employment, the government said, okay, contracts cannot be end due to COVID-19, and at least the minimum wage should be paid. What is the minimum wage in Sri Lanka according to the law? 14,000 rupees per month. 14,000 rupees is about $75. So $75 per month, that is the minimum wage, at least that should be paid. So the question is whether this is enough for a family for 1 month period, $75 or $70. And health medicine for regular clinic attendees, actually government took immediate action, because now clinic attendees, especially people who have long-term diseases, or people who attend clinics due to different other reasons, and they lost the opportunity to attend clinics. So government started sending medicine for this by post, but you have to WhatsApp the prescription. So who has the WhatsApp facility and internet facility to send the prescription? So again, I think although government took measures to address these issues, still people who do not have these facilities are unable to send their prescriptions, so no medicine for them. And education also like that. So schools were closed. Still schools in Western province in Sri Lanka are closed. But, they started virtual education, through different ways, especially on Zoom as well. Students who do not have computers, who do not have internet facilities, enable this education. Next, I'm also going to give some examples from India as the next country. India also had several measures. I'm mentioning few only here. One is to provide 8 free refills for the 5 kilograms, and 14 kilograms only 3 times. And also set up retail shops that is called Suraksha in Hindi, and also I think Bhasa is also the same word. In Sinhala, my language is also same, or safe stores, to ensure that citizens get essentials. And with 3 months salary of fund, and also under the social assistance program, they provided financial support to old age people, widows, and disabled people. So those are the measures, some of the measures, examples in India as well. But at the same time, and now you can see that they bill for 5 kilogram gas cylinders and only 14 kilograms. So it was so more poor people more times but at the same time, although some measures to help people, at the same time also to consider most affected people. Next, please. So in this situation, what about the vaccination? Whether the vaccination process address needs of those left behind. Now you can see in some countries, the leader of the country or vaccination first. So what about in the countries? Of course, in most countries, in Sri Lanka, Indonesia, and other countries also, prioritize some people, and that is understandable. Health workers, police, and other armed forces who are dealing with citizens and who need to be vaccinated and safe, because they are mostly contacting or in contact with populations. But at the same time, whether there is a process to address needs of or prioritize most disadvantaged people is a question. I don't see this prioritization in Sri Lanka, India, or some countries. Next, please. So what is missing? Now the question is with government policies and government
Marcella, I think
evidence-based.
Your connection is breaking a bit.
Can you hear me now?
Yeah, it's clear, but sometimes breaking.
Sorry, I think sometimes it's shaky. Let me know if it is still a problem. I can change to.
It's fine now.
The internet can. Okay.
Yeah.
Whether policies based and whether the policies are for whom, which purpose. And now, if they are evidence-based, definitely, so that should serve the needs of the people, needs of the population. At the same time, where are the needs of the most disadvantaged populations, whether these policies address them, and whether mechanism to implement these address the needs of the most disadvantaged populations, and also to see whether the most affected people are considered in the policies. And of course, we can see now the examples I took. Most of the policies, the most needy people are addressed, but at the same time, whether it is really practically addressed, and also implementation is such that they get the benefit out of it. And where is evaluation to inform these policies, and whether to based on evidence, and is there a proper evaluation system in place in our countries to inform these policies? So these are the things I want to address here. Next. From Marco Segone, but I really like this slide. This shows among all the SDGs, Sustainable Development Goals, 2 goals about poverty alleviation and gender equality. At the rate of implementation of SDGs now, we can reduce the poverty or eliminate the poverty only in 2072. At the rate of implementation now, we can achieve equality in the whole world in 289. None of us will be there at this time. So this situation, if we do it at this rate, and the way we are doing it, we won't be able to achieve poverty and gender equality. Others are also like that in 2030. So it is not possible to achieve SDGs, most of the SDGs 30, if we do it like that. Next, please. So that's why evaluation is important. We need to use evaluation to accelerate SDGs, also to inform policies. That's where we can see where the results we can achieve, and also how to achieve results, and also how to serve the needs of the most affected people. We will be able to
your voice is gone now, Asela.
UN resolution.
Asela, yeah.
Can you hear me now?
Yeah, but sometimes it's breaking, so it's not stable. Can you please move,
okay.
Or if you have other alternative connections? Yeah.
Hello?
Yes, we can hear you.
Yeah. Ocean evaluation in 2014, that's emphasis evaluation capacity building for the achievement of its development results at country level. And resolution on transforming our world, that is the Agenda 2030 for Sustainable Development. And also I want to mention Global Evaluation Agenda 2016-2020. It is up to 2020, but there's no new agenda yet, so this is still applicable. These emphasize need for evaluation. Next. And with this situation, with this context, Asia Pacific Evaluation Association with Evaluate Asia and other partners, we thought of developing our own way of Asia Pacific is a huge, diverse collection of 50 nations and 5 sub-regions, and there are largest and smallest nation on the earth. And if you take the highest populations, China and India in Asia Pacific region, and very small islands in Pacific area, and varying capacity in terms of evaluation policies and systems, Australia, New Zealand, and different countries. And some of the small islands are under, please. So if you take Asia Pacific region, actually all countries have national evaluation policies. Sri Lanka national evaluation was in 2018. Philippines has national evaluation policy framework in 2015. Japan has an evaluation act, and India is embedded in the constitution. If you take many other countries in the world, there are so many countries, especially in Europe, several countries have evaluation policies and systems. In Asia, we don't see evaluation systems, but at least we see that few countries have evaluation policies. So we see the gap in terms of having good evaluation system to inform our policies, government policies. We need to have evaluation policies and systems. Evaluation should be there, but only few countries have evaluation.
Hello. Asela, we can.
Yeah, with this.
Okay. Asela, are you there?
Please.
Okay.
Yes.
Okay. So you have 5 minutes. 4 minutes now.
Yeah.
Okay.
Thank you. Yes. So we developed the Asia Solution strategy. In this, and this is a roadmap, 8 thematic areas, and this is to promote evaluation in the next, please. So this is the theory of change of the regional evaluation strategy. It talks about standardization of evaluation, developing partnership for evaluation, strengthening community ownership, promoting young and emerging evaluators, engaging parliamentarians, promoting national evaluation policies and systems, using nations and societies. So these are the 8 themes we have developed. And with this, we want to implement this to promote evaluation in the region, please. The strategy was launched on 10th of December, and we have disseminated it widely and mobilizing partners to contribute, and also encouraging dialogue, collaboration, and commitment to action. So this action is very important. This is not just a document, but we want to have actions to promote evaluation. So evaluation capacity is credible evaluations, independent evaluations, so that we have evaluative evidence in the region and our countries at national level to inform these policies. Next, please. So with this, I want to mention that all of us promote evaluation and also see how we use evaluation.
Marcella, your voice is breaking, perhaps. Hello? Sorry, perhaps try turn off your video. The voice is breaking.
Yes.
Sorry for that.
Okay, thank you. Yes, so how we partner with all the organizations to promote evaluation is connected, and I appreciate. And sorry about this internet. Hope somehow you got the message. Thank you very much.
Okay, thank you, Asela. Let's give some applause for Asela, and we'll go ahead and take some time for question later. So just a reminder, please be sure to type your question into the question box in the control panel in the chat box. While also our team will provide simultan subtitle. So Bapak and Ibu, ladies and gentlemen, we come to the second panelist, Search Eric Yaku, the eval rockstar from Africa. So please, Search, now the floor is yours, the same like Esela, for 20 minutes. Thank you.
Thank you so much, Ume. I'm so proud and be honored to be with you today. I'm connected with you from Ottawa in Canada. It is 3:57 or almost 4 a.m. in the morning.
Oh my God.
And then, you know, this is our challenge when we want to work with people. We want to work for people and then provide support, and then you also engage and involve you, asking you to be, you know, always ready. So that's why I was so happy to confirm my participation, whatever my flight was canceled to Sunday for Cameroon.
Thank you.
First of all, I want to congratulate you, the MONEV Studio, for this opportunity. And also, very congratulations for the open remark. I like it. It was very, very thought. And I will follow the step of my friends, Asela, with very impressive presentations to share with you some lessons learned and best practice from the African countries about, you know, this ongoing world pandemic due to the COVID-19. Next, please. So briefly, I'll move you through these 3 items of the agenda, starting with the regional strengths regarding the impact, you know, having like global loops about the extent to which the pandemic have been impacted the economy, social, and even the political strategy in Africa. But of course, as like Asia and other countries in the world, we look at what are the key response in West and Central Africa. To be more specific, I would get you to one policy which support educations. As you know, the education remains the most tough field, basically for Africa, if you want to really support and build on resilient system, not only for the COVID-19, but for all other pandemic or all other challenging development challenge happening in Africa. You know, I want to name, you know that in West Africa, Ebola was been there for a long time, in Central Africa as well, but also the ongoing tourism all white Africa. Then finally, we look at questioning why we did evaluations. You know, evaluation for evidence-based decisions. We are talking about tackling strategy at the government level and also the continental level to face this ongoing pandemic on the proper way so that no one left behind. Next, please. So this globally, the most updated map, you can see that today again, the most affected remains North America, United States, Europe, and somehow the South Asia. But Africa, we have the ongoing viruses spreading within Central Africa and Eastern Africa. In Southern Africa, only South Africa remains the most impacted because in Namibia, there is not COVID. In Lesotho, there's no COVID. So there are so many countries in Africa where you can't find COVID anymore, like in Mali as well. But the new variants, is now being spread with travelers. That the African countries decide to open the border, but by implementing restrictive travel measures so that they can control the level of the spread of the viruses. Next, please. So, more specifically, that Africa today remains the little impacted regions by the COVID-19. So, as compared to the announcement did by the WHO or UN Secretary General early in March 2020, by where they were threatening to see that Africa, maybe as the most weakest region in the world, will receive a large number of cases and also the large number of deaths. But today, with a resilient system in Africa, basically because of, as you know, as a sunny countries, scientists prove that a sunline or most open sun countries constitute one of the key barriers to viruses, given the nature of the virus itself. So maybe that could be why Africa is the most less affected countries. You can see that the people recover sometimes without no more medication or with using local barrier. We are going to see that. Next, please. So yeah, I want to just get you now more specific to Central Africa. The first graph is about the world cases up to December 2020. But in West and Central Africa, these are the actual figures by the end of 31st January 2021. You will see that West Africa is more affected than Central Africa. My country is Cameroon. And then today, again, the number of cases remain very low. And then the number of deaths is not yet around 500. Next, please. Typically, we are talking about the impact of the COVID-19. And then in Africa regions, the most affected policy was education. The first graph is showing you a kind of graph mapping of the school closure in Africa. You will see that those in red were partially open. This was Togo, this was Benin in West Africa. And then the other one, it's on right, was where they closed, the school was closed due to the COVID-19. But there are some countries, as I said, do not have COVID-19. This was between March and June 2020. This is like Sudan and also Tanzania. And then, but the actual graph is showing that, as I said, Namibia, Lesotho, and most of the part of Angola are very less affected by the pandemic. But somehow, the other graph is sharing with you a simulating of the potential impact, mostly at the school closures, moving from the mitigation's effectiveness to the most outcome. But as you know, at the education level, there are two main criteria, which are the learning aspect and the schooling. So how the countries are being able, to combine most mitigative effect or strategy to combat the pandemic so that students or let's say school-age students are least affected. In the other way, with the objective to provide inclusive outcome. Basically, if you're looking at the SDG, which is SDG number 4, supporting resilient education system. And then you may see like this kind of interactions, which you need not only the government effort, but also partners and civil society support in order to reach the outcomes. So there are three key outcomes on the graph where countries are looking to move. Basically, learning, to adjust, the approach and the policy in place so that they can easily adapt to the pandemic, and also support average learning. But for those, the most least, or the most vulnerable layers of the population, where they have least support, they have very limited capacity. Next, please. Then I just resume here to be more specific, as I said, to just get you on the education level. So today, we are having the second variants, but the first ones impacted mostly the school closures. And then there was kind of unequal access to the digital learning resources because the school was closed, and then the country was obliged to, to adopt digital learning system, which mostly at the secondary level, but at the primary school, there were systematic closures of school. And then at the university level, it was also closed, but governments, most around Africa, like other countries in the world, moved to a digital learning. And then finally, also, but not the least, the influence on the remote locations on inequality, but by considering the conflicting setting or conflicting regions. Central Africa regions, Mali, you have Congo, who are the most conflicted regions for more than the past 2 decades. Next, please. This graph just show you the West Africa SDG and the strength dashboard. Just to highlight, if you want to reach the SDG 2030, with regard to the educations, you will see that moving from Benin to Togo, which are the 14 countries or 15 countries in West Africa, you will see the level of improvement being reached by countries. Then, for example, if you take the case of Senegal have a good step toward education, and they have the greatest chance to reach the 2030 agenda by promoting, a most resilient education policy, and also getting, as compared to their policy, about 90% of school-age category of people to attend school. So, and then in green, there are very few countries on the green track, looking at the board, the most least measures dealing with the infrastructure at the school. But of course, as you know, other conflicting countries like Mali, whatever they are facing those difficulties, but the quality of education is going down. You will see the arrow is red. Next, please. As compared to West Africa, in Central Africa, the picture is somehow a little bit different. You will see that country like Cameroon, where I'm coming from, have making very slight progress as compared to other Central Africa countries. We have, this is the ECOWAS criteria, which is covering not only Central Africa, but also countries like Congo and Gabon. So many countries were affected by the crisis, like Chad and Congo, dealing with education are going now very just small improvement to provide quality education to the school age children. Next, please. Then they all want to support resilient policy, and then to provide finances, in education. However, this graph is showing the gap for the objective. If you want to support the UN's son to leave behind, you can see that moving from 2015, when we launched a every-year campaign at the UN level and also at the country level, at that time there were 11% gap into the education, into the financing for education. And if you want to reach by last year was 2020, the gap was increased 5 years later to 18%. And then it's expected that maybe if nothing is done, we need about 29% gap in the financing education. This shows that there was slower progress than projected. So from 2015, we may say 5 years plus, the year campaign, and then very soon, in 4 years later, we got, like, let's say, the middle term to evaluate or to assess, the 2020 agendas. Next, please. Then let's just look at some country measures or country response, basically at the West and Central Africa regions. So these three graphs show you three different pictures. The first one at the beginning of the pandemic was like testing, using, taking the temperature testing, not only for the traveler, but even for the school. This is the school pictures. The second one is about testing for those who have are using, like, when the first testing measure was in place with the bottoms, in the nose. And then now we are talking about vaccinations. But in between the two, there's a treatment. Many African countries believe about treatment than in vaccine. Why? Because they are not yet pretty sure about how we can vaccine people, or mostly, let's say, because they are very, very, very less or no published proof that vaccine can solve the issue, or vaccine can immune the system of people in Africa, not only in Africa, but in the world. And then also, they are looking to get a guarantee about the vaccinations measures to immune people so that they can get not only the COVID, but also the flu. But anyway, it's really improved. Next, please, we see that in the next pictures are some improved policy. Next, please. Then, in between testing and to reach the vaccination step, countries are being implemented 4 key policy. The first one is about distance learning, not only at the school, but also in the public office. The adaptation of learning during the crisis, as I shared with you, with the digital learning. And then promotion of health and psychological protections so that people, or mostly the most vulnerable people, can be protected. And finally, they're looking to improve the financial education. But the graph on the left side is sharing with you the overall coordination policy to provide a social protections globally, not only at the country level, but at the regional level. You may see that the budget gap remains about the food security level as compared to the education and social protections. So there's a much needed support to finance the food security, nutrition, and health as compared to other policies like livelihoods and multi-sectors. Next, please. Then another policy or strategy put in place by African countries, as I said before, was the lockdown. Some countries apply systematic lockdown. Like you may see countries like South Africa apply national lockdowns, South Africa, Kenya, Rwanda, Congo, and Mauritania, Djibouti. So those countries apply systematic lockdown, but other countries provide some localized recommendation about travel or about also opening a business at the country level. So, but the second graph is just shared with you the 3 main measures applied by most African countries: washing the hands with soup, mostly with soup, because they don't have, many people don't have money to buy the alcoholic gel, to clean the hands. Even in my house in Cameroon, in my office, I just have many soup and also many water pumps. And then at school level, there are so many water pumps. Secondly, the social distancing. As a scientist, for those who have to talk about physical distancing than social distancing. I mean, if you are keeping the world social distancing, you are creating the gap between people. And then in Africa, it's a social countries or continents. People want to keep the touch base together. Next, please. And then 2 famous countries in Africa produced treatment for COVID-19. The first country was Madagascar. This is the president of Madagascar sharing the COVID organic, which is being used to cure people. And then national statistics prove that about 95% of those who have been affected by COVID-19 was recovered. And in Cameroon as well, there's the COVID-19 plant-based remedy, which is having very effective solutions. And then most African countries are thinking about treatment than in vaccination. Of course, they are looking about how, to what extent the vaccination could be the best policy, given the fact that the second, if the post effect of vaccination could even be very few measurable. They are not sure about who is going to pay the bill of the post vaccination, because very few or no study are yet available about vaccination of human being. You know, we are talking about those 60 plus age, or let's say adults in the vaccination. Who's going to pay the post effect of the vaccinations? Is it the government? Is it the partner? No. It's, people are asking, they're not yet sure. So it's like a bracket. But people going to open their eyes like a Tanzania to see, oh, let's see how it's going to come. But they believe that the country is full of resources, natural resources like plant-based solutions. As you know, the country has been the unique in the world to provide input for the lab, medical lab worldwide, the big pharma. Next, please. Then let's look at the role of education, because the pandemic itself needs to control. It needs to emanate, let's say, emanate a strategy. In Africa, as you know, the APNOD remains the big main body at the African Unions, I mean the African Parliamentary Network for Development Evaluations, to support a most resilient system and to promote national evaluation capacity at the Africa level. Of course, with the support of their partners, with our UN and also other donors. And then APNOD remain the key players on board with a systematic policy, with the monitoring system. Next, please. So this graph is sharing with you, if you're talking about evaluations to face the pandemic, it's not totally different to other crises, as I said, in Africa. But if you reach a middle level about the supply and demand side, are people demanding for maybe vaccination? Yes. Or what is the capacity, not only for the country, the partner to provide vaccination, but the country are looking about a resilience or most autonomous strategy to face the COVID-19, instead of keeping applying foreign approach to getting vaccination from abroad. So countries are looking at to support national capacity, you know, to locally produce either the treatment or vaccines. Like, you know, as you know, countries like Tanzania also starting having their own vaccinations, you know, which is like a spray vaccination. It means like it's a small tube you can just put in your nose instead of having a shot. So an evaluation is good to question all this, both the APNOD role, but as you know, there are ongoing wonderful program, the Trendembele, you know, which is a cross-cutting partnership initiative, mostly in West and Central and Eastern Africa, but also the EPRADI, I mean the evaluation platform for Junior African Development Institute. So these are the overall actors, but in between the two sides, the supply and the demand side. And of course, we are all focused on the UN resolutions, the Ben 2.1, but mostly the 2015 UN resolutions to transforming the world, and then to make sure that we don't leave no one behind. Next, please. Finally, the evaluation strategy itself also needs the support of private sectors and civil society. As you know, in Africa, Africa is our continental region, VOPES, who have this kind of strategic role to support national evaluation association, so that the evaluation principle is being embedded at the country level by implying a systematic approach to national evaluation capacity development, both including, as I said, at the institutional level and also at the individual level. So this is very important to get those two key players and actors involved. And then finally, next, please. So at the Event Indigenous, as you see, I was talking about, you know, an indigenous approach. I mean, African approach to support, you know, or to face the COVID-19. There are local practice being implemented. And we at Event Indigenous, we are promoting the indigenous principle not only for evaluation, but also for other policy measures in the world. So be the change we want to see in the world. These are our messages. We think Gandhi was right to say it. So whatever the solutions coming from, it should be first seen as the change we want to really see for tomorrow. Thank you so much.
Thank you so much, Serge, for a really nice presentation. Let's give some applause for Serge. So for those who just joining us, welcome. I hope you enjoy all the presentations. Now we have the last panelist, the last but not least. So Ibu Vivi from the Ministry of National Development Planning will talk about the context in Indonesia and also some insight based on the presentation from Asela and also from Serge. Thank you. Ibu Vivi, now the floor is yours for 20 minutes. Thank you so much, Ibu.
Thank you, Mbak Umi. Can I have an access to share screen? Very good afternoon to everybody and very early morning to Serge in Canada.
In Ottawa, yeah.
Really appreciate for joining with us. I also want to extend my congratulations to MONEV Studio, yeah, for this is the 5th MONEV Safari. It's really appreciated to bring a culture of evaluations to Indonesia and many communities. I saw some names in several regions actually. So for those of you not familiar with Indonesia, Indonesia is spreading all over from Los Angeles to New York. So we also appreciate for people coming from different regions of Indonesia. I'd like to share my screen. Okay. Extending to the discussion that have been brought by Asela and Serge on evaluation, I would like also to share the role of evaluation to some program in Indonesia, particularly in relate to the social protection policies. Of course, like other countries, Indonesia also part of countries that hit most by COVID. Up until now, we are on the rank of 18 for the number of cases of COVID-19. So I'd like also touch upon some impact of the COVID for Indonesia, and later on share some strategies to tackle the COVID as well as the role of evaluations. This is only to share that we have a vision to be part of the developed countries in our 100 years birthday in 2045. Yeah, there have been several estimations and also projections that showed Indonesia would be the 5th economist by 2045, and still with a big population. Currently, we are in the 4th populous country, and we're going to be a 7th populated country by 2045. But and along the line, on the way to 2045, we're going to be part of the countries that also committed to achieve for SDGs in 2030. So the 2030 agenda would be a basis for us also in our journey to be a developed country in 2045. However, by 2020, not only we still have several challenges in competitiveness compared to other countries, not only in the regions, yeah, but also other continent. In a global competitiveness index, for example, in fact, it's decreased from 45th to the 50th in 2019. In government effective index, we actually improve, but we have to see that our neighbors is actually also running faster than us, much better. Yeah, would be in Malaysia, Brunei, Singapore, as well as in our Human Development Index. So as you may also know that our country that has impacted by the COVID can be shown to this updated data. In January, February 5th, the projection, the release from the Central Bureau of Statistics showed that the economy actually been contracted minus 2.007% on average during the whole year from the last year. So these have been impacted to other indicators as well. In unemployment, we could see here all the provinces. We have 34 provinces in Indonesia, and all of them has increasing open unemployment. Yeah, on average, we increase around 2%. So the current open unemployment in Indonesia is increasing from 5 to 7%. This is mostly due to people reduce the mobility, and they cannot sell, they cannot perform, and in fact, in some cases, they also they've been laid off. Yeah, not only reducing the income. So because of the pandemic, impacted not only to the economy but also to the welfare of the people. This is coming also from Central Bureau of Statistics, who just last week released the poverty that show Indonesia new poor increase around almost 1%. It is hard because actually it's now exceed our poverty number figures. Is above 2 digit, yeah, become 10.2%. Now we could see here the green line that show the increasing number of poor or new poor actually happen in urban area, which is mostly in Java. Yeah, so this also show that the increasing number of the poor due to the pandemic. The pandemic hit most in Java Island or in big provinces who people live mostly in this area. We could also the extended impact of pandemic in the education. Search tell nicely about the impact on the education. This number coming from the study of the World Bank that show on the learning disruption that will impacted to the learning loss. This show about the PISA score projection, which actually for reading score, Indonesia already at the bottom of the rank, and it's become worse off due to the learning disruption by the pandemic. So the learning loss is part of our big challenges, because our population currently around 72% is on the productive generation, the productive group, which mostly is the young generation, the millennial, the Y and the Z generation. and many of them are in schools. So this is very challenging for us, how to catch up as well as to improve all the program. In 2020, to reduce the risk and also the impact of the pandemic, we expand the existing program by or modify the existing program by expanding the targets of all the social assistance, not only from the social part but also from the education and the economy part. We expand the size of benefit and then also modify the distribution channel and time, because all the response need to be expedited, particularly to the people who impacted most, which is the poor and also the vulnerable. In some places, there is also a new programs. This is the example food assistance in Jabotabek, yeah, and also the cash transfer to 9 million household mostly in Java region, and also the training pre-work card. This is particularly for the ones who have been laid off and or also reducing the time period of working. So many social safety net actually help us to reduce the people that are vulnerable to getting poor. It is estimated by the World Bank, for example, that our poverty will increase around 2.35%, and also Semeru Institute also projected up until 3.2% for additional new poor. But in fact, like you've seen in the previous slide, that in urban area, actually the increasing of the poverty is less than the projected number. So it's only 1.3. This partly due to the social safety net scheme that quite generous and quick to distribute to the most needy one during the COVID-19. Of course, this is not the perfect situations. There have been several challenges, mainly in the database and also the distribution channel. But in fact, having the update from the data, we could see that the social safety net scheme that we went through in 2020 help us to reduce the poverty than as projected before. In this year, Indonesia, part of the country in the regions that already start with the vaccine. So we actually already started in January to target in several segments. Having considered that our database is not perfect, we swift the strategy to go for the vaccine by cluster. So the wave one, we go with the, I think like other countries experience, we go with the health staff. Yeah, it's about 1.46 million people. And then later on, like this week, we already started with the public servant. So like in my office, some of us, or I think it's around 2,500 staff already vaccinated this week. Yeah, so the public servant in Indonesia is around 16.9 million. And also from last week, actually, we already started with the elderly by 21.5 million. Yeah. So January and February, we already start the vaccination, and it will be continue with other vulnerable groups and the rest. Yeah, the vulnerable one is around 63.9 million, mainly because they are already part in the system of the social insurance scheme, as well as in our social registry. So by having this, we could reach now the rate of the vaccinations per day is above 120,000 per day. Yeah, if you see on the left hand side on the bottom, we could see the progress of the vaccination trend. And if you see the small progress is on during the weekend. Yeah, so this is the data that we rely upon for make sure that the vaccination going to everybody in the countries in order to develop a herd immunity around 70% of the population. Some reforms that will be
Sorry, please mute the mic. Hello. Sorry, Bu Vivi.
Okay.
Sorry, Bu. Please continue.
Yeah. So in addition to the ones that I've mentioned in relate to the social safety net scheme as well as the vaccine, in 2021, I mean this year, the government also start with the major reforms. Yeah, have learning that our system is not perfect. One of the reform that will going on in 2021 is national health system and also the national social protection system. There is a big major not only on the vaccine. We will also to expand the facility, the infrastructure with the labs, immunization, as well as expanding the membership of the social security system. Within the social protection scheme or social protection reform, the major activities will be on revising the database. I'll tell a little bit more. The other reforms also in the sectors like in what is it, the food, by developing several food estate in order to have a resilience in food and also in disaster scheme. In 2021, we expand also the programs in strengthening the SMEs, because we learned that actually the vulnerability in Indonesia is quite huge. Despite that our middle class is growing, is around 70%, but in fact, around 40% of them, or almost 50% of the middle class is actually in what we call as an aspire middle class. Yeah, so many of them are actually engaging in small medium enterprises. In fact, when they are not getting the part of the program or the poverty programs, their database is very weak. So we call it as a middle, the missing middle problem, because many of their data is not on the database. Yeah. Some of them are not in a social security system because quiet for them is still not affordable when they have to pay the contribution in a regular basis. And some of them not part of the in a database for the poor, for the poverty programs, because they are not the right recipient for the poverty. They are not part of the poor, but they are not in the sufficient condition as well. So many of them, in fact, are in a missing middle in regard to the database. Yeah. So that's why we work together with financial institution, banks, and also several others in order not only distributing or channeling the fund or the assistance, but also little by little we want to develop the database for these SMEs. Up until now, we already collected around 26 million by name, by address of this group. Yeah. Like have been mentioned by previous speakers, that the pandemic indeed impact on the SDGs, not only one or two goals, but almost all. Yeah, from the UN data study, it shows that when the people impede not to reduce their mobility, they need to reduce their economic activities. That's in fact also impacted to the quality of their food, the quality of their health, the education, and in fact, despite that the pandemic could make a better of the quality of air, of the weather, because people not mobile, but in fact there are other challenges to the environment, from the addition of using plastics from the protected equipment, protection equipment, and as well as additional use of the plastic for our containers, food containers, and several others. So all of these activities actually showed that the pandemic bring the interlinkages impact on the SDGs. The pandemic indeed has brought risk for the achievement of the SDGs in 2030, but I've mentioned that it also opened up the opportunity for reforms of the many system and policies that in previous we thought it's already okay, yeah, but in fact it's not sufficient to handle the crisis like a pandemic. And maybe in the future the crisis can be stronger. Yeah, that's why we have to change our perspective, our approach to be more complete, as we have committed through the SDGs. So the triple bottom line is not only about people, planet, and profit, but it actually need to balancing all the way go through the more balanced situation, balancing the social, the environment, the economic, and in fact also the good governance aspect. So I could say that the future is actually now. It's not waiting till 2030, but when we're talking about the new normal, is actually we need to act now, bring in the principles, the goals, the target, and indicators of the SDGs as a guide to develop or to create, to build a more inclusive, equitable, and also the sustainable development. Like in vaccine, for example, if we exclude some of group of people or country, actually it will bring some risk for us when we meet them and they are not shielded by the vaccine, and it will bring some risk on the spread of the virus again. Yeah, so that's why we need to aware that actually no one left behind is not only apply to 1 or 2% or 1 to regions, but in fact it's global. Yeah, it's about no one left behind, also for country. No one country left behind in the context practicing the new normal or creating the future. So back to the country, this is the trajectory of the social protection reform. This is along the line with our midterm development plan, but in annual plan for the government, we also need to include the plan in order to achieve the SDGs. In 2021, for example, like I've mentioned earlier, that we're gonna do the survey for social registry to expand the database. So the plan is expanded to up until the 60% 60 percentile people. Yeah, so including the people that have received social assistance during pandemic, and also the one that have been waiting list in the social insurance, for example. Yeah, so by expanding the social registry, we expect that we could build a concept of social protection to be more adaptive. Yeah. This is also bringing the integration of the social assistance, not focusing only on the social, but also on the economic aspect, yeah, like on the SMEs. Of course, on the updating data, we should bring local government for them to have a capacity in more regular basis that they could update the data in the future. Yeah, the digitalization of the social assistance will also expand it to the remote areas, mainly in eastern part, and of course accelerating on the exploring of financing, yeah, in order to bring all this stuff in reality. The social registry development that we plan is from the village. This is also linking to our village, what is it? Information system in the village. Yeah, in this situation, we are now in the process of inlining with the Ministry of Village on the SDGs, on the village SDGs. We need to elaborate or to translate all the indicators of the SDGs that we are tapping from the global up until the desa village. What does it mean? When we are talking about the poor at the village, can we use the macro data from the Central Bureau of Statistics, or we should think about more micro data level, which shows about the names, the rosters of the family, and where they live? That's the example. That's why the social registry development need to be linked with the information system at the village level. On the
one more minute, Ibu. Sorry.
Okay, on the digital transfer, still progressing during the COVID. At least almost 80% of the social protection or the social assistance go through the digital scheme. This is the way the transformation of the digitalization on the social protection in other countries progressing. This is the way we are thinking to develop adaptive social protection. For sure, we are rely upon on the data and use a theory. And when we are talking about the use the data and refining the theory, we go through using several testing or piloting into this system to make improvement along the line with the implementation of all the programs. This is pretty much straightforward, yeah. Starting with identifying the problem, diagnosis, and then also using the data, testing it, and refine the solution. This is only the examples that we go through how to refine all the social assistance. The rice subsidy, for example, there have been almost 20 years in place, but using around 67 evaluation, we could transform it to be part of the more digitized social assistance. Now, no more rice subsidy. Now we already transfer it into the food voucher scheme using the electronic voucher. In the bigger context, this promote our food security and also value for money, particularly when we are talking about improving food for stunting and also other problems of in relate to the nutrition. The effectiveness of the CCT in targeting, this is also help us to refine other social assistance to go using the impact studies and then learn from it, tooling into the to the banks. At the end, this is to conclude. I think we have a clear path toward the 2030 agenda when we are talking about universal social protection. This go along with the improvement of the database, improving the channeling through the digitalization, and also linking to the sustainable livelihood. We do hope that all this scheme will help us to bringing back on track to the achievement of the 2030 agenda. I'll stop here. Thank you very much.
Thank you, Ibu Vivi, for a very comprehensive presentation. Let's give some big applause to Ibu Vivi and to all presenters, to Asela, Serge, and also Ibu Vivi. So now we come to the discussion session. So please be there. Serge, I hope you're still awake. I think you have a very good coffee there. I wish I can send you another Torabika coffee. Okay. So Bapak and Ibu, thank you for sending your question in the chat box, and also later we can hear you more. So we have a very short time here, only 10 minutes, but we would love to hear your voice. So the first question is to all presenters. So can you give a sample of effective evaluation approach in ensuring the no one left behind principle? So based on your experience, which one is most effective one? And then from Pak Eka Dompu to all presenters. So during the COVID, the violence to children and also women and also early child marriage incident is increasing. How is actually this evaluation can influence to anticipate these incidents? And then to Serge from Bapeda Pemalang. So he has some concern on the impact of COVID-19 in education. So the economic impact can be restored quickly, but it is not easy to make students to catch up their study that they have left for more than 1 year. Do you have any strategies to solve this problem based on your experience in conducting evaluation in many countries and region? And then to Asela, how to promote evaluation results, particularly speaking to power using evaluation to ensure the no one left behind principle from the vaccination and also social protection, since you have a long experience in evaluation advocacy. And the last one to Ibu Vivi, as the IBDAT alumni yourself, having evaluation capacity, now you become the key player in social protection policies making in Indonesia. This is a very great role. So Ibu Vivi, what make you different from other actors who is pursuing the same career, but they have gaps on evaluation capacity? So I think your learning is very important here. Thank you. Yeah, maybe Asela goes to Asela first. And then later, Pak Imam Karyadi will talk on behalf of Pak Beni, the head of the Bapeda, to reflect on the presentation by the panelists. Thank you. Yeah, Asela.
Yes, thank you, Umi. I hope now you can hear me well. Let me close the video if it is better. So yes, there are several questions. Now, with regard to this, violence against children and women, it was mentioned, several times that during COVID-19, violence went up. That may be the reason, because now with the lockdown, people are, always in one place, and of course, children are also bored, and then they don't have, enough space for to play and all, and also study, and studies are, also neglected. So things like that. So at the same time, now how evaluation can be effective in these situations. So definitely it needs, real information and data to prove this, violence went up, right, against children and women, and also the number of, early marriages went up. So that is what, the major role in monitoring and evaluation, special evaluation. So that we have to see how to do that. And also with the COVID-19, the use of internet and use of electronic devices went up. And of course, data collection remotely is now more, I think, in my personal opinion, is possible with this. And also setting up, now there are hotlines and all, but with this situation, hotlines are more, effective, I think. So information collection is more important. So with this information collection through evaluation, and also, doing more rigorous studies, it can be proved, and definitely can then it will be helpful for the governments and policymakers to make relevant policies on this. Regarding, how to use and promote evaluation using power, actually where most of the places or countries or organizations, why monitoring and evaluation is a missing part, mainly the lack of leadership or the organizational commitment. So that organizational commitment, the leadership, the buy-in from the leadership is very important. And in general, it says that evaluators are not good advocates. That's advocates, and that's one thing. And secondly, evaluators are not good communicators. And now I can see, there are, a lot of advancements regarding evaluation community using social media, Twitter, Facebook, and communicate the value of evaluation, and also see networking, things like that. That is really needed. So evaluators should be very effective communicators, where we communicate, quality and credible evaluations. That is one thing for policymakers to use. At the same time, convince policymakers, leaders, and citizens about the value of evaluation. Mostly we complain that people don't understand evaluation and citizens don't know about evaluations. So rather than complaining that, we have to see how do we convince people about value of evaluation. I think that is the challenge we have. And now I see with always also with young and emerging evaluators. Now it is communication is getting more dynamic. In Asia Pacific region, we have initiated a new platform called APC Hub, Asia Pacific Communication Hub. Especially, this is only for evaluation, to communicate evaluations, and there are very active young evaluators managing this, and it is online as well. So we have taken some of these initiatives. I will stop here because of the time. I'm happy to come back if there's any need for questions, but I will give the floor to others. Thank you.
Thank you, Asela. Now, Serge. Yeah. Thank you.
Thanks so much. Thank you so much. I think I'll follow from Asela's point of view because, as you know, we don't invent the wheel. There's nothing new. It just depends on the way we are adapting or improving, what exists. So about the question on the effective evaluation approach, to make sure that we don't leave on behind, let's just regard the context and the culture of the African countries, which imply that we should always use what is been there for a long time. The approach you consider, for example, as we said at the very engineers, the engineer principle by using, for instance, storytelling approach. Technology is not really well spread in Africa, but connection between people is very, very strong. People are strongly connected, with ingenious way of doing. So the storytelling into the evaluation strategy, as Asela said, the mobile technology is very, very always well spread in Africa. And then one example to be more economic efficient is using the mobile banking or mobile financing, which is making a difference as compared to other institutions like a bank or like a government institution. So the approach should be really local sensitive, adapt to the context and also to the culture of people to make sure that they accept what is proposed. So if the solution is not accepted by the population, they will not buy in. So we should be able to put in place, like I'm saying UpNote, to speak at the African regions, because UpNote is our global institution at the African Unions to work with the parliamentarians. So this one I can share with you. But then second question about my experience, we are talking about educations. Economic strategy are there, and then I've been there for a long time. Family, and then I just looking to the government to keep implementing what was calling to do. So having like canteen at the school level, canteen, I don't know how you call it in Indonesia, it's a place where school-age children can get access to food. And then
canteen,
exactly, student canteen on the very least courses. And then the government could just simply close everything and stop. No. So I have been in many countries doing evaluations. I saw in Lesotho a very effective canteen approach with health measures, even like having some kind of sanitary barriers. It's very easy to protect these people and promote educations. Thank you. Maybe I may add more if you have more time.
Thank you so much, sirs. Okay, Ibu Vivi. Yeah.
Okay, saya dulu ya.
Yeah.
Okay. It was started in 2007 actually, when I and another 7 colleagues went to Carleton University for APDET. The second chance is in another year when we really learn about what is the real evaluation. Of course, we did have and know about the what the MONEV, but in fact, there's no such certain tools or method that we use. So since then, we learn about how to do the real evaluation, the right evaluation, and in fact, we also trying to promote a culture of evaluation. By having that, we start to work everything, start from the data, and then also try everything to set aside of the funding in the beginning to develop what we call as an impact evaluation. Because without sufficient funding, we couldn't have a proper evaluation. So for some big program, for example, in our CCT, as well as in our empowerment program, since the beginning, we set a survey for a baseline, and then later on we design also the midline as well as the follow-up or end line. Then we could measure the impact, yeah, in quite robust way. In many cases, we use the RCT part. So by having that, using the result, we could actually improve our program. Yeah, when we know, for example, that the empowerment program in urban area have a reducing impact, then we start to think about why we should push on the infrastructure, because adding up 100 meters road, for example, in urban is almost useless, yeah, to improve the welfare. That's why we use the result to refine the program, to expand also to the productive activities. That's only one example. There are many inputs from the studies that we have help us to refine the programs in more effective way. Other positive way, we also got a sufficient support from the parliament by showing more result based, yeah, showing the data, the analysis, and also open up input from several from other partners that do the evaluation, like the 67 evaluation in Raskin or in a rice subsidy, for example. It's been done by many universities. So having a discussion with them, we could bringing result-based improvement to the programs, and finally get more support to from the parliament, particularly when we are talking about the continuation of the program. That's the first question. The second question is on the digitalization. Yes, we are again, Indonesia is not only about Jakarta or Java. We should aware that other part of the country is not digitalized yet, yeah. But that show the system of the social assistance, for example, need to work together also with the banks, with the telco, and several others in order to really cover the whole country. So the examples that you mentioned on the vaccinations mainly apply only for the city, the capital of the province or the kabupaten. If you click the link for the vaccinations, it only goes for the ones who live in the capital. Yeah. Later on, starting next month, when more vaccine come, of course there are other modalities that we use. Not only using the link for the registrations, but also open up the registration at the puskesmas, the health post, for example. That's several. For sure, we are not talking about one mode when we are talking about covering Indonesia. We should think about several modality to make sure that everyone included, particularly in the vaccine. That's all, Bu Mi.
Thank you so much, Bu Vivi, for addressing the questions. Lastly, we have Pak Imam Karyadi, who will talk on behalf of Bapeda Yogyakarta, and also to say something if this session is really meaningful toward the future development of monitoring and evaluation system for the social protection in Yogyakarta and also Jawa Tengah. Please, Pak Imam Karyadi.
Yes, thank you for everyone. Let me say about the reflection with bahasa. Mohon izin, Bapak Ibu sekalian, Ibu Muihani, Bapak search dari Eval, kemudian Ibu Vivi, mohon izin menyampaikan dengan bahasa, kemudian Bapak Asela ya, Mr. Asela, Kalu Gampitia. Mohon izin kami menyampaikan sedikit refleksi yang ditugaskan kepada kami dari Kepala Bapeda. Yang pertama, kami sangat mengapresiasi event ini. Kami sangat senang sekali diundang di dalam forum ini. Dan forum ini menjadi bahan kajian kami karena dalam 6 bulan ke depan kami harus menyusun kajian terkait dengan dampak dari pandemi di Yogyakarta. Kami akan dalam proses menyusun kajian, sehingga bahan dari webinar ini akan sangat bermanfaat untuk pemerintah daerah istimewa Yogyakarta. Jadi kami sangat senang sekali bisa ikut dalam forum ini. Bapak Kepala juga menitipkan pesan pada kami untuk memperhatikan setiap rekomendasi yang disampaikan dalam webinar ini dari Bapak Asela, kemudian dari Bapak Search, Ibu Vivi, sangat kami perhatikan. Kemudian terkait dengan apa yang sudah disampaikan tadi sebagai refleksi yang kami terima dari forum ini, leadership yang disampaikan Pak Asela tadi itu menjadi menjadi sumber utama dari bagaimana keputusan dari daerah untuk menggunakan hasil evaluasi. Untuk DIY, kami sudah menerapkan rapat koordinasi pengendalian, di mana itu dipimpin oleh kepala daerah. Kami mengevaluasi itu setiap triwulan, di mana peran dari gubernur sebagai kepala daerah dan sebagai raja, karena kami daerah istimewa, itu sangat diperhatikan oleh semua OPD. Jadi hasil dari asesmen evaluasi dari semua dinas itu menjadi perhatian. Jadi seluruh kinerja dari dinas yang ada, termasuk dalam hal penanganan pandemi, selama tahun 2020 kami perhatikan menjadi rekomendasi untuk pimpinan dan rekomendasi untuk pemerintah pusat. Ya. Yang kedua dari Bapak Search terkait dengan updating dan adaptasi, kami juga melakukan adaptasi Bapak di internal Pemda dan seluruh aspek di DIY untuk menerapkan protokol kesehatan dalam rangka melakukan evaluasi, monitoring dan evaluasi. Jadi kami selama setahun ini sudah menerapkan monitoring dan evaluasi secara daring, memaksimalkan forum-forum video conference, kemudian menegakkan protokol pendataan, tracing, dan sebagainya ketika kita melakukan MONEV, termasuk dalam hal adaptasi teknologi. Jadi mungkin Bu Vivi di RPJMN juga sudah ada ya terkait dengan transformasi digital. Jadi saya menyampaikan sekaligus untuk Bu Vivi bahwa transformasi digital di DIY ini dipercepat karena pandemi, Ibu. Jadi RPJMN-nya belum selesai, tapi transformasi digitalnya sudah dipercepat. Jadi kami juga mengapresiasi dari upaya-upaya yang sudah diinisiasi oleh Bappenas. Kemudian kami juga sudah memiliki sistem informasi untuk monitoring dan evaluasi yang sebetulnya dulu diinisiasi juga dari Bappenas, dan kita kemudian melakukan modifikasi seperti yang dipesankan oleh Pak Sels tadi, bahwa updating dan adaptasi itu terkait dengan kebudayaan setempat itu penting, sehingga kami sudah berhasil memodifikasi, mengadaptasi baik itu kerangka regulasi dari Bappenas, dari Kemendagri, ke dalam sistem monitoring evaluasi yang kita terapkan. Juga terkait dengan adaptasi yang terbaru selama 3 tahun terakhir, kami menerapkan balance scorecard. Jadi kami melakukan adaptasi, melakukan rekayasa sistem, di mana balance scorecard itu bisa untuk menilai kinerja dari seluruh aspek dinas yang ada di Pemda DIY. Jadi kami sudah bisa menilai dari aspek bagaimana improvementnya, bagaimana aspek kinerja fisik maupun keuangannya, dari efisiensi dan sebagainya, itu dari pengembangan dari balance scorecard yang sudah kita adaptasi dengan kebutuhan dari DIY. Begitu Bu Umi Hani, Pak Sers, Pak Asela dan Bu Vivi, kami senang sekali bisa terlibat dalam forum ini. Semoga kita masih bisa punya kesempatan di lain hari untuk ketemu lagi dalam kondisi yang lebih sehat, ya, dan terbebas dari COVID-19. Semoga ya. Salam sehat selalu dari kami semua. Bila wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Pak Imam, for brief insight. This is very important. So, Serge, Asela, and also other non-bahasa speakers. So, Pak Imam already stated his appreciation with this presentation and also the forum. So, in the next 6 months, he will provide some assessment for the current policies in social protection and also in vaccination. So this session, the material is really important to give some feedback on that process. So and also this will give some opportunity for the adaptation in improving the monitoring and evaluation capacity at the regional level. So Jogja and in Jogja and also Central Java, we have around 23 district and the city, ya, Pak Imam, ya. So I think this is a really an impactful session for the government official and also the civil society organization in Yogyakarta and also Central Java. So, Bapak and Ibu, it looks like that we have covered all the questions. So now, please give us some opportunity to thanks to all speakers and also the host, Pak Beni, Pak Imam, Asela, Serge, and also Ibu Vivi. Sorry, we could not give you more opportunity to talk since we don't have more time and we already exceed the time. Especially to Serge because it's already 5 a.m. I think. So I hope you'll be okay for tomorrow. And I would like to give some wrap up. So basically, robust policy to tackle the impact of pandemic, including with the some innovative policies like vaccination and also social protections, with the help of meaningful monitoring and evaluation, is an urgent need to address the poor, vulnerable, and marginal society with appropriate policies. So this is contribute to universal social security, protecting all people from the threats of the pandemic, to their health, to their economic, social status, and ideally be integrated in a broader effort to strengthen the existing policies, and more importantly, to make more people more protected by the state. So thank you everyone, Bapak Ibu, distinguished ladies and gentlemen. We appreciate you being here, and thank you to Mas Iwan, and also from the MONEV Studio team, Fajar, Likwina, Nailul, Ria for hosting the event and for simultan translation. Thank you very much. Thanks again for joining us today, and we will see you next time. Take care and stay healthy. Now Likwina will coordinate us for a group picture. Yeah, thank you. Assalamualaikum warahmatullahi wabarakatuh. Ibu Likwina,
Thank you very much. Thank you so much.
Yes, ladies and gentlemen, once again, thank you for joining the webinar. I'm reminding again for you to fill in the Google form attached in the chat box. And now I'm heading to take our picture together. Please take a look into the camera. 1, 2, 3. Okay.
Turn on your video.
Yes, turn on your video, please. Everyone. Okay. 1, 2, 3. Once again. 1, 2, 3. Okay, thank you.
Thank you so much.
Thank you, Bapak Ibu.
Thank
Thank
you.
you,
Bye-bye.
Bu Vivi.
Bye-bye.
Search.
Stay
Bye-bye.
safe.
Have a good
Bye-bye.
sleep.
Yeah, bye-bye.
Thank you, Asela. Thank you, Bu
Bye-bye.
Vivi. Thank you, Pak Imam.
Thank you.
Bye-bye. Bye-bye.
Thank you.
Thank you.
Bye-bye.
Thank you.
Assalamualaikum.
Bye.
Thank you, makasih. Maaf
Bye,
terlambat.
Serge.
Nggak
Bye-bye,
apa-apa,
Asela.
Pak.
Asela,
Ya.
bye-bye, my friend. Bye-bye.
Please fill in
Bye-bye.
your full name,
Bye-bye.
Bapak Ibu, for the certificate. So make sure you put the long name. Bapak Ibu jangan lupa untuk mengisi nama lengkapnya di sertifikat untuk sertifikat di daftar hadir. Terima kasih semuanya. Sampai ketemu di Safari bulan depan.
Materi akan kita share lewat Google Drive.
Baik.
Ya.
Terima